If you're in your 70s or getting close and you feel perfectly fine, this might be one of the most useful videos you watch all year. Because there are 3 medical tests that for generations were treated as automatic. Routine, something you just got every few years because that's what you do. And quietly, without much of an announcement, the people who actually write the screening guidelines in this country have changed their advice on all 3. For a healthy person over 70, they now say these tests often carry more risk than benefit. Most folks never got that memo, so today I'm going to give it to you. Let me be completely clear right up front about what this is and what it absolutely is not. I am not telling you to refuse anything. I am not telling you to skip a test or to cancel an appointment or to argue with your doctor. That is the opposite of what I want. What I'm going to hand you is 3 good questions. Questions that the latest guidelines from groups like the US Preventive Services Task Force actually support, so that your next visit is a smarter conversation. Every single thing I tell you is backed by those official recommendations, and the links are in the description so you can read them yourself. This is education. The decisions stay between you and your doctor. And there's one idea you need first, because it's the key that unlocks all 3. In medicine, it's called overdiagnosis. Here's what it means in plain English. When you screen a healthy person who has no symptoms, sometimes you find something, a slow-growing something, that never would have caused them a single problem in their lifetime. But once you've found it, the train leaves the station. More tests, a biopsy, maybe a procedure. And each of those steps carries its own real risk. So past a certain age, for a person who feels well, the very act of looking can sometimes do more harm than the thing you're looking for ever would have. That's not a conspiracy, it's just arithmetic. And it's why the guidelines change as we get older. Hold on to that idea. Let's count down the 3. Number 3, a heart stress test. When you feel completely fine and have no symptoms. This is the one that surprises people most because it feels so responsible. Let's just check the heart while we're at it. And to be crystal clear, if you're having symptoms, chest pain, breathlessness, unusual fatigue, a stress test can be exactly the right call, and you should absolutely have it. But here's what changed. For someone with no heart symptoms at all, who isn't high risk, the major heart organizations, through a program called Choosing Wisely, backed by the American College of Cardiology, now advise against routine stress testing. Why? Because in a person with no symptoms, the test throws a lot of false alarms. And a false alarm doesn't just go away. It leads to a heart catheterization, maybe a stent you didn't need, maybe blood thinners for life, a whole cascade of real risk kicked off by a test that was only ever meant to reassure you. So the question to bring to your doctor is simple and calm. I feel fine and I have no symptoms. Is a routine stress test still recommended for someone like me? Or could it cause more trouble than it's worth? That's number 3. Number 2, the routine colonoscopy. Once you're past about 75. Now, I want to be careful here because colonoscopy saves lives. It truly does, at the right ages and especially if you have symptoms or a family history. But look at what the guidelines actually say. The task force gives colonoscopy its strongest recommendation through age 75. From 76 to 85, it stops being automatic and becomes a personal decision, something to weigh with your doctor based on your overall health. And past 85, they advise stopping routine screening altogether. Here's the logic, and it's the overdiagnosis idea again. Colon polyps usually take 10 to 15 years to turn into anything dangerous. If you had a clean colonoscopy in your 60s and you're now 78 and feeling well, the prep and the procedure carry real risks today: dehydration, a small chance of a tear, complications from the sedation, while any benefit might be 10 or more years down a road you may never need to walk. The exception, and it matters. If you have symptoms, bleeding, a real change in your bowels, unexplained weight loss, that's not screening anymore. That's a reason to be checked, and you should be. So the question is, given my age and my health, do I still need routine colonoscopies? Or have I reached the point where the guidelines say it's a personal choice? That's number 2. And number 1, the one with the clearest guidance of all, and the one I most want the men watching and the women who love them to hear. The PSA blood test for prostate cancer after age 70. This isn't a maybe. For men 70 and older, the US Preventive Services Task Force gives PSA screening its strongest possible no. It formally recommends against routine PSA screening at that age. And the reason is the purest example of everything we've talked about today. Most men, if they live long enough, will have some prostate cancer cells. Autopsy studies have shown this for decades. The vast majority of those cancers are so slow that the man dies with them, never of them, and never even knows they were there. But a PSA test can find them, and once it's found, here comes the train. A biopsy, which carries a risk of serious infection, then often surgery or radiation, for a cancer that was never going to shorten his life. And those treatments can leave a man with lasting problems with continence and intimacy. That is a steep price for treating something that would have quietly minded its own business. So if you're a man over 70, or you love one, here is the question, and it's a kind one to ask. The guidelines now recommend against routine PSA testing after 70. Is that right for me? Or is there a specific reason in my history that I'd still want it? Because for some men with a strong family history, the answer might still be yes. And that's exactly the conversation to have. That's number 1. So let's bring it together, because the 3 tests aren't really the point. The point is the one idea underneath all of them. After 70, more testing and better care are not the same thing. The goal was never to find everything. It's to find the things that, if we find them, we can actually help you with, in a way that adds good years to your life. Sometimes that means a test. And sometimes the kindest, most modern medicine is knowing which test you've earned the right to set down. So here's all I'm asking you to do. Don't refuse anything. And please don't change a thing on your own. Just take one question to your next appointment. Pick whichever one fits you, the stress test, the colonoscopy, or the PSA, and ask it exactly like this. Doctor, at my age and with my health, will this test actually help me live longer or better? Or could it cause more harm than good? That is not a difficult patient question. That is the question of someone who is paying attention. And a good doctor will be glad you asked it. If this gave you something useful to think about, or you're already picturing someone in your life who needs to hear it, do 2 quick things for me. Share it with them. And subscribe, because everything we make here is about helping you stay healthy, sharp, and independent for as many good years as possible. Take good care of yourself, and I'll see you in the next one.